Thank you for staying tuned. It is still the conversation here on Lagos Television. You don't want to know why we are laughing.
No, 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 please, no, please.
And on this side, we have taken a critical look at the health sector here in Lagos. Lagos health sector development. That is the topic today. As the population continues to grow, the demand for accessible, affordable, and quality healthcare becomes even more urgent. Now, joining us on the conversation this morning, we have a medical practitioner here with us, Dr. Mohammed Isa. You're welcome, sir.
He's not just a medical practitioner, he's a friend of the house.
Of course, yes, he's a friend of the house. He is a friend of the house.
Thank you very much. Thank you for having me. I'm actually happy to be here again. It's been a regular place for me to be here.
You're welcome.
It's always a delight to have you here.
Yeah, so discussing Lagos health sector development, it's going to be also an interesting part of me because the Lagos city is a city that continues moving. And the movement cannot stop. However, when we come to the health sector, we're not only just about the movement, we're about the precision. So we're going to look at this matter. I want to use a performance metrics, not political lens, to see what exactly is going on. And when we look at that critically, let's look at what this administration has been able to set on in terms of an ambitious foundation that's really robust to work with. Example, look at digital health ecosystem, whereby this administration has been able to take our hospitals away from traditional delivery to a data-driven healthcare system. Now you get to hospital now, they put in your name here with the nurses, and doctors already are seeing it there. Unlike before, they have to carry all the files. You come 5 years later, it's gone. Now we can actually trace your data. We can identify what you've been coming for over time. The hospital can make research easily. The Ministry of Health can access whatever is happening in a hospital. All of this were not there before. That is very, very important. Again, when you look at it again, professional development is now one of the key performance indicators. This seems government have been able to establish University of Medicine and Health Sciences. What is that for? That's actually designed basically to actually intervene in this problem of brain drain, whereby Lagos State can actually begin to produce over 1,000 doctors per year. And that can actually fill the gap of the challenges of burnout of those that are existing in Nigeria against those that have gone. So if you're looking at that aspect, that's like a proactive intervention, something that's about happening, now becoming a problem. You've gone ahead to establish a very formidable system that is waiting to deal with that effectively. That's a very laudable idea.
Okay, I like the fact that you talked about the health sector being digital now, because I had a very terrible experience way back just before COVID, where I had to wait 6 hours to get attended to. You know, that was the days of dropping cards, and then you wait, and then you wait for them to come and call you, which can take another 2 to 3 hours. Yes, I'm really, really glad to hear this. And you also talked about the health sector in terms of infrastructure. Let's look at healthcare delivery now. How would you assess, you know, the current state of healthcare delivery in Lagos today? Are we where we are supposed to be, or there's still, you know, room for improvement?
Okay, thank you very much. Like I said, setting up the foundation is already done. What is left is the implementation gap.
Okay.
You see, putting infrastructure in place is being done. For example, look at the greenfield and the brownfield redevelopment of Yaba and Bagada General Hospital. This is laudable to actually meet up what is going on anywhere in the world. Look at the General Hospital being constructed in Ojo, following the annual operational plan of Lagos State. And this is key, coming from the Minister of Health, to make sure that every event, every action in the ministry is targeted on the budget and ensuring that there is one goal. That goal is that one budget, and one spending, one patient, and safety return back to the budget to ensure that every penny spent can actually be assessed on the outcome of patient. Now, this has been the target. Give that to the Ministry of Health, working tirelessly over time to see that working. Now, when you look at delivery, and you don't want to compare Lagos with any state in Nigeria, it is far not comparable. So, to develop, we don't need to condo that. We need to look at those ahead of us. And I can tell you that for those ahead of us, so far, we have been able to catch up far more than before. Example, look at our primary health care centers. Those days, they are nowhere to go. You don't go there. To do what? To go and meet goats that are running around the place? No, today, we have the infrastructural development of a primary health care center all over. And that's not enough. There are some area called flagship health centers. They run 24 hours.
Just like...
And there's a doctor there, there are nurses there. They take attendance of all patients that comes in there, except what's beyond them transferred to general hospital. So when we come to where are we have gone very far. It's just implementation. The implementation aspect that needs more attention, example, is the area of low health insurance enrollment. Now, if this government have been able to bring this up, that nowhere in the world where healthcare system is performing well, it is about insurance. Unfortunately, many people walk on the streets yet to be aware that there's an insurance that can save them. They go around to beg for money. Why what they are begging for could have been inserted in their insurance scheme. With little amount of money, they benefit from the pool of large amount of fund available. Many people are not aware of that. Okay. Now, there's also this agency synergy. Ministry of Health now, working with traditional medical board, which was not operating like that before. That tells that there is a collaborative effort. All is about Lagosians. Now, when you look at the agency, monitoring agency, look at EFAMA. EFAMA is responsible to monitor every hospital in terms of activities and performance, quality of the employees. Are they qualified doctors, nurses? EFAMA is doing that effectively. No other way that's done in Nigeria. Then again, look at LSBTS. This is the body responsible for blood. In Lagos State, you don't access blood without getting the government approval. Why? Some nefarious activities could go beyond that. You can even get the blood of a goat and give human being. But because of this agency, that is not possible. Okay? And for any hospital to access such blood, you go to the rudiment of accessing such blood. So you're talking of a system that's structured to actually monitor what's happening away. So that's about even government. Similarly, private is being monitored by the same government because it is the life of Lagosians that go to private as well. So it is not good that go to private and a human being come to government. So monitoring all this together is still responsibility of this ministry, and it's going on effectively.
So I want to take him up on the issue of, sorry, Joy, I want to take him up on the issue of primary health care centers.
Okay.
You were here one day where a resident in Badagry, said that the primary health care center in his access, did not have good that there was nothing to work with there. That there were snakes, and the roof had fallen off. I still have the story on my phone. I'll try and look for it. And that leads me to the question of, are these primary health care centers, are they evenly distributed in Lagos State? And do you think primary health care centers are, receiving adequate attention they are supposed to receive?
Good. That's where I talk about implementation gap. This government has picked up primary care center more serious than ever before.
Okay.
So if this trend continues, I can assure you that what you have gotten at that time will become a forgotten story. Yeah, because infrastructure is there. Some still have problems with water. Some still have challenges of toilets. Some still have challenges of staffing. Okay, And this present administration is working on that and getting them one by one sorted out. It's not easy to sort them together like that, it's a government system, but it wasn't the way, it isn't the way it was before. Yeah. Sure. And that's where we're talking, when we're looking at development, we have to look at where were we before? Where are we now? And does it government, this administration realizes where are we going? And that's what we can actually give to this system, that they actually foresee what is ahead. And I think they're putting a lot of things in place to ensure, okay, look at the Lagos State in terms of population. This is the only state that you cannot predict the population. So far in this insurance that I mentioned, only 1.4 million people have registered for health insurance in Ilera Eko, while we have over 24 million people living here. So what are we talking? Will government go to people's houses? But I said, implementation, there may be need to now link up Ilera Eko with some mandatory services. Example, you want to renew your vehicle car, your papers should be linked up there. Produce your insurance number for health before you renew your car, vehicle papers. That will help us to get more people into the system and we can resolve a problem. I just left the place and we just had a meeting. Somebody came in and said he wanted to beg for money. His wife has just been discharged. Her leg was swollen. I said, okay, if her leg was swollen, so do you need to come here to beg for money? Take her to hospital. And he said he doesn't have money. I said, why didn't you do insurance? He said he doesn't know what's about that. I had to sit down and explain all of this to him. That with little amount of money, you can actually key into that. Your wife will have access to see a trained, qualified doctor, get the right diagnosis. Then you'll be left with treatment. So that cannot be sorted out. You are sure, once you get a qualified doctor, then you'll be sure you get diagnosis. Then treatment become easier. But what is killing our society is that majority of our people still patronize quacks because of poverty, still go through wrong ways. By the time the whole thing is bad, they want to come and see correct doctors. And at that stage, the doctors and nurses run into trouble.
I found the story. This was last year, July 2025. Pota Primary Health Center in Ikoga, Zebe, Badagry, Lagos State was infested with snakes, forcing nurses to abandon night shift. The facility, which serves over 40 communities, was found in a severe state of dilapidation with snakes in the labor room and laboratory.
Okay.
So that was last year.
That was last year.
Sure by now.
If you can actually put our touchlight there again, you might actually see a different story. I can't say much about that center, but I think it will have been a different story.
All right, you've listed a number of gains in the health sector. What the government has been doing to put structures in place to ensure that things are working and to also ensure that Lagosians access better health care. But again, for you who is in the system, what are some of the challenges that are still prevalent?
The prevalent challenges are obvious. There is challenge of burnout of health workers. This is tremendous. You see doctors falling sick, nurses taking excuses, laboratory not coming to work, pharmacists are tired. That tells you there's paucity of health workers. And like I told you, implementation becomes very important. So government will begin to see as time goes on that this set of people that are still remaining are working out their life and their time. The idea of establishing a university of medicine and health sciences is to actually avert this trouble. And so that's why I said in my introduction that far ahead, in another 5-10 years, the problem on ground will be protracted if nothing is set up now. And if you're having a university that will be producing health workers, doctors, nurses, pharmacists, technicians, and all of them, it tells you that the burnout challenges we are going through right now could become a matter of past. So that's one. Again, we talk of implementation, we talk of equipment and instrument to work with. So that's also very important, that government is, filling some of those gaps gradually, and it's becoming better for doctors to use equipment that is available to work. In the past, it used to be very difficult. whereby basic things you need to use are not available. But today, it's getting better. We are not there yet. I hope you get what I'm trying to say. We're not there yet, but it's been a bit better than before. Then talk of environment. Environment also very important in terms of where you walk. In the past, some areas you don't even feel good to meet a doctor in the hospital. It's not even looking well. The road you take to get to his room is not even attractive. So, but today, infrastructure development has actually begun to change that narratives. And we begin to see, doctor, you're right there fine. So that's becoming interesting. So if patients are beginning to say that, oh, this place is now better than before, that tells you that somebody is doing something somewhere. So apart from this, what is causing welfare? That's I'm coming. That's the place I'm coming of. You see, those that are doing this work, it's not about salary increase, and it's not enough about infrastructure alone. The workers now need what is called total compensation and welfare strategy. And why I bring up this is that it's not enough to give somebody 25,000 naira for doing well. Let our workers begin to see the chances. Example, maybe a government subsidized housing scheme for them, where they now know that, okay, working this much, there's a route to which you can actually have access to housing that you don't need to burn out your life to actually achieve that. So that may be better compensation than increasing their salaries, as a matter of fact. So beyond that, people need to be encouraged more. People drop dead so easily now in hospitals as health workers, which is due to stress. They're the one that preach against stress, but they are the one that are more stressed out. So that's how it is, and I think it's been better than before, and could be better than this if the trend continues as it is.
Okay, let's look at access and affordability. How affordable?
Access to healthcare.
Access to healthcare.
Okay.
Healthcare costs, remain a constant concern or a major concern for residents. How affordable is quality healthcare in Lagos today? Yeah.
Okay, thank you very much. That's a very good question. Considering the Nigerian economy and the trend of the country, yeah, like I used to tell anyone, that there are three things that are actually worse than the deadly disease. What are those three things? Number one, poverty. Number two, ignorance. Number three, can you make a guess? Sociocultural beliefs. These three things are worse than the deadlier disease you know. Okay, when those three things ravage a country or a community, so what do you expect? Even with ignorance, when there are healthcare services there, they don't go there. Okay, those that want to go there do not have the economic capacity to do that. So how do we go about that? That is where we talk about health insurance. Government will not give everybody money to go to hospital. It's by establishing something that just keen to it, at least basic things can be addressed. Okay? So in terms of availability, we have how many general hospitals in Lagos State? How many care centers? Put everything together with teaching hospital, about 360 healthcare centers in Lagos State alone. So tell me, where else again? So it's there. It's about people not assessing. And what is militating against them not assessing is those three things I mentioned. If awareness campaign can be stronger and people get to know that if I came to insurance, I can get basic things, then there will be no problem. Because it's not easy, even you sitting down here, to wake up 50,000 naira for a nail that pinched your leg bleeding that you never planned for. You know how painful it could be? I'm talking 10,000 naira that you never budgeted. You find it difficult. But you have health insurance, you will access the care first. And imagine other countries like Ghana, Kenya, that started after us, have been able to achieve over 54% health care insurance coverage. Nigeria, as we speak, is less than 20%.
Why do you think there is a decline in people accessing this healthcare insurance, aside from the fact that they are ignorant? From your own perspective.
Is the awareness enough?
Yeah.
The awareness, well, we cannot say it's enough because people in the rural area are yet to even know what we're talking about.
Yeah.
In the villages.
In the villages.
They don't
the
even know.
underserved areas.
But that's where government also bring up another thing called community healthcare system, whereby in this village, and you are the Olori of this village, the wife of the Oba, you can be the head of healthcare system. And then we begin to create a center. Look for a nurse or a doctor that sits down there. The community pays him. The community rally to do the local advertisement or announcement that, oh, you know, that also, we're missing it as well. And I can tell you, I grew up in a village, and such thing existed that time.
Village.
Well, you don't bother to know about it. Is this Lagos State village?
Village in Lagos State.
Yes.
It's our mega city.
Yeah, yes.
Is it somebody's village?
Okay.
So it's just the fact that we're beginning to lose that communal life. In those days, you get a wound from a street, you will not get to your own house before the elders on the street take care of you. Now we have lost that. In the metropolis, nobody even sees you.
Everybody's minding their business.
So government is saddled to do all of this. Government is ready to do it, and they're actually doing it, but it can never be enough. Because the volume of human beings coming into Lagos per day is beyond what you can imagine.
That's leading me to my next question, that overcrowding, in as much as the hospitals are being digitalized,
Yeah.
overcrowding remains a major issue. And even when I'm discussing with friends and colleagues and I say, oh, why don't you just go to a general hospital or a government-owned hospital?
Because of the wait time.
It's the wait time. Can that challenge be forever solved? I'm sure it's a fact.
It can be solved.
It can be, because with a population of over 20 million, some are even saying over 22 million now.
Yeah. Yeah, you see, what is going on? Some general hospitals are beginning to be more innovative and more transformative.
Okay.
And that is about data. Today, some of them use digital system to book appointments.
Okay.
By making sure that, okay, you're coming to see a cardiologist. They've checked the list, there are about 100 of them for today. The cardiologist will not be able to see more than 50.
Can you even see
So,
50
no, they can say, okay, number 1 to 50, please give them a message on a WhatsApp, tell them to come early. Why tell the other people to come next week? Okay, with that, some general hospitals have been able to reduce that wait time, especially for those that want to access specialized care. Okay, but those are coming for general care. That's where the struggle is. So far, you want to see endocrinologists, it's very easy to prorate number of people that will see that endocrinologist today. So that all of you don't come, crowd the place, you are 40, you attend only to 10, the 30s are grumbling. No. Okay, the other way they do again, if you have 2 endocrinologists in an hospital, you come early around 7 o'clock, and the clinic starts 7. By 10, 11, that one will slow down. The other one takes over till around 2 p.m. With that, it's also reduced the crowd. So those that come early among the patients are attended to by the endocrinologists that came early. The one that we have to come around 10, the other endocrinologist that's taking over, do that. So with that, we've been able to reduce that crowd in some general hospitals. And I think some other hospitals are taking a lead or borrowing idea from all these, because we now have it's easier to know what's happening in the hospital through digital system. Data will come for meetings, and then you get to X-ray what's happening in your hospital, and then we begin to know how you've been able to address some challenges, and that's been very helpful so far.
Okay. Do you want to go? No, it's okay. Okay, still talking about Lagos healthcare sector development. How strong is Lagos when it comes to preventive healthcare versus reactive healthcare?
That's a very good one that you asked. The 2 areas I would like to establish some facts. Lagos, in terms of preventive care focus, I begin to work on chronic disease, whereby they do some areas screening for hypertension and diabetes. And that's a very important aspect because those two diseases account for almost 80% of chronic disease that exists in the world. So that's going on. Two, are you aware that Lagos State infectious disease resilience preparation is one of the best, that even UK have sent people to come and find out what we do here in Lagos. You cannot believe that. So I give this to the chief epidemiologist of Lagos State in person of Dr. Absalam under the Ministry of Health through the Commissioner for Health, Professor Akinbayomi. Now there is a robust architecture in disease surveillance. Okay, are you not aware of Lassa fever killing all over state? Do you know what this ministry put in place in the last 2 months to every health centers and health workers on high index of suspicion? That if you walk into the hospital now, from your complaint, the first doctor that sees you have a suspicion that maybe it is Lassa fever, and is going to cascade the information immediately. This is in place. So I can tell you that we have been able to stay ahead of any disease. So because of the global challenges of pandemics, disease all over, Lagos have taken a lesson from that and established those ways to actually suspect. You don't want to wait till let it happen, then we start treating. No. How do you suspect that it's coming? How do you suspect that it has entered? So that ability, we have it now, and then we have our screening center, our bio laboratory that can actually screen and get a result of those diseases that we need to take to South Africa, take to India, take to America before. All of these are now available with Lagos State healthcare system. So in that, I can tell that we have been able to move ahead of that significantly. The first one I told you about hypertension and diabetes was not ever there before. Today, put Nigerians 100 together, 80 of them have hypertension or diabetes. 80. So what are you talking? So you're talking of a population where many people are sick. Okay, so now if government is now doing something to screen, they go to community and
even
screen
the local
them.
governments.
Yes, they organize things like that,
outreaches,
exactly, and just screen for diabetes and hypertension. And now, even in the healthcare insurance, the Ilera Eco particularly, established drug for hypertension and diabetes differently from the treatments. Once you are known to be, you are on register, you come every 2 weeks to pick your drugs. That's already been established through community pharmacy via Ilera ecosystem. Community pharmacy means that, okay, the hospital has picked you up that you have hypertension. This is an age-long disease. So instead of you coming, having a headache of how to get your drug, you get the prescription, you go to community pharmacy, pick it up, and you're gone. So all of these are designed to prevent problems that say, oh, if we know we have done this, and I think that is working
just
for
the
us.
final question for me. Yes,
Okay,
final.
How about to be final for
Yeah,
it?
looking at the time.
I have final too.
Okay, final. Okay. I just want you to share practical steps that Lagos residents can take to better manage their health.
Okay.
When you look at stress level, look at condition of the economy, you look at your pockets, just practical tips.
Okay, we're talking about practical steps in maintaining health. First is know your limit. What I realize in practice is that many Nigerians, people that live in Lagos, do not know their limits. You wake up in the morning, your body tells you that you're not okay. You carry your car and start driving to VI. So that means you refuse to know your limits. 2, you must design your way of doing a regular checkup. To check yourself up is cheaper than to wait for it to happen before you treat. Once you know your limits and you do medical checkup, you are done. The last one is you must adopt an active life. Yes, Lagos is, you cannot be in Lagos without having an active life. You want to go from here to Yaba, you know how long you stay in the bus stop before you get a car? You're on your own. So there's active life already. But then, are you aware of your stress level? Do you go to check whether you have been stressed up? What you enjoy doing can be the source of your stress. Sometimes what we enjoy doing that gives us money, we earn so much from that, is the source of our stress. But because it's solving other problems, you're not aware. You need someone else to tell you that, oh, madam, this job you are doing is taking a chunk of your life. And so that's how we can go about it to live a normal life. Because you all here, the elegant woman I'm looking, you have a tailor that do your clothes, you have a hairdresser, you have cleaners, you have a driver. Do you have a doctor? Joy.
Do you have a doctor?
So those are practical steps.
You must be a psychologist, or maybe you read minds. She's someone that doesn't even like going to hospital.
It's even good that she can have a doctor.
Well, yeah.
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 Do you have a doctor?
She doesn't have.
I have a doctor that we call.
She likes going to pharmacy. Thank you very much for for the health tips, Dr. Mohammed Isa, medical practitioner. We've been talking about Lagos health sector development, and as we've all heard this morning, developing a resilient health sector is not just about buildings or structures or policies. It's about people, access, and of course trust in the government of the day. Thank you very much. We're going on a short break. When we come back, the conversation will continue.